Right, I think we'll get started now. I'll see if I can get us going on Facebook. Well, thank you very much for joining us, everyone. Good evening. My name is Liz Somerville, and I'm the practice manager at Lockleven Equine Practice. I'm here really just to manage your questions and keep Jenny company for the evening. So Jenny is going to speak to us this evening about equine gastric ulcer syndrome, and she's prepared a talk for us. So what we'll try and do is get through most of the talk and then do some questions at the end for everybody. So if you do have any questions, I know some of you have already emailed those across to me, so I've got those and I will keep those for Jenny at the end. But if you've got any questions, you should see down the bottom of your screen either a Q&A box or a chat box. Ideally, if you can put them in the Q&A, it'll just make life slightly easier for me to keep track of the questions at the end. And obviously, if you've got any problems, you can also, or any comments, you can pop those in the chat box as well. So I'm going to hand over to Jenny and sit back. Hopefully you've all got a cup of tea or a glass of wine with you to enjoy, and we'll get started. Thanks very much, Jenny.
Okie dokie. Well, thank you everyone for joining us for this COVID very, very safe client night that we've got here. It's not quite the same, I know, without Patty's cakes and all the home baking, but hopefully you've got enough to keep you going. I'm going to be talking to you for probably round about an hour. I'll try not keep everyone too long, but make sure we get all the information across that we need to. And as Liz said, we'll answer some questions at the end. So the whole talk is going to really be about everything you need to know about equine gastric ulcer syndrome, what's the cause of it, why it happens, what we need to do about it, how can we manage it, how do we treat it, and how do we prevent it. So we'll get cracking. We use this sort of general term, equine gastric ulcer syndrome, to describe the whole syndrome. We have recently got slightly more specific ways of naming the condition, which we'll come to when we know about the different parts of the stomach that can be affected by the disease. But we tend to still say equine gastric ulcers as a sort of umbrella term to describe this syndrome here. We can just have a look here and see this really nice graph in front of us as to the prevalence of gastric ulcers in the different types of horses, and not necessarily so much breeds, but with what the horses are actually used for. And you can see here that an astronomical percentage of race horses tend to be affected by this condition, and we'll come to the reasons why slightly later on in the talk. But what's also very, very important to look at is the different types of horses and the different jobs that they do and how badly they can be affected up to the levels that we can see here. So what you can really see is that the competition horses and the horses that are particularly active in sporting roles are the horses that are the worst affected by this condition. What's important to also look at, however, is just thinking about our leisure, pleasure, sort of happy hacking horses. A lot of them can still be affected with this condition as well, that we maybe don't consider quite so much as we do with the sort of higher active, end of the scale of the different jobs that these horses do. So as I said, we've got the sort of generic umbrella term here of the equine gastric ulcer syndrome, but actually we can break this down really into two different terms here. So we have got the squamous gastric disease, which is when we get lesions seen in the top part of the stomach, which can also be broken down into sort of primary and secondary disease. And what we are predominantly interested in, by far the highest prevalence, is the primary squamous gastric disease, which is basically related to how we keep horses and how we manage them and how we feed them. And the other term that we've got over here is the glandular gastric disease, which is when we can see lesions in the bottom part of the stomach. And we'll come to the reasons why just shortly. We take the data that we've got from this presentation here from the experts that have correlated all the information and the consensus studies that we use to base all our treatments on to make sure that we're up to date with everything. And these consensus studies have showed us that only approximately 1% of the horses that we have in this country are actually treated for equine gastric ulcer syndrome, which is a particularly low percentage when you think about the number of horses that can be affected with this condition. So it is worth remembering that there's a lot of horses out there that are suffering from gastric lesions, but are not actually treated for it. And that's important to remember that. One of the difficulties that we have as your veterinary surgeons is being able to tell you whether the horse has or has not got these gastric lesions. The difficulty that we have is that there is not one single clinical sign that allows us to give you a definitive diagnosis just by listening to your concerns regarding your horse or us clinically examining your horse. What we have got is we have got a list of clinical signs that are relevant when considering that gastric ulceration may be an issue with your animal. And what we have got is we've generated a list of possible clinical signs that could be shown by your horse when you're considering, and we are considering, that we may have gastric lesions here. And as you can see, there's a particularly big list here. The word poor does come into this a lot, between whether it's just poor performance, the horse is not eating properly, you're thinking that your horse is just not in appropriate body condition compared with what you are feeding it. You know, the horse is just looking generally just in poor condition, you're just not happy with how the coat's looking and such. But as you can move through this, we've got very, very general conditions, clinical signs that you could possibly see if your horse was suffering with gastric lesions there. What you will also notice from this list of conditions is that they are not specific just to gastric ulceration. So for instance, looking at poor body condition, there's a lot of different causes that, or conditions that could cause a horse to be in poor body condition. You could just think about a high worm burden. You could think of an older horse that may have equine Cushing's disease. You could have dental problems that could cause that. And this is where it's difficult for us as your veterinary surgeons, is that we have to know for certain that we are treating the right condition. And that's why we need to have specific diagnostics in place to tell you for certain that your horse is suffering from these conditions, because we can only get an indication that it may be from the clinical examination and the history that we can get from yourselves and from assessing your horses. We're going to move on now and look at why are these horses so prone to getting gastric ulceration, because it's a condition that we nowadays are talking about it a lot. But why is it that they are getting these lesions? And to answer this question, we have to slightly go back and think about their evolution. And if you look at a photograph like this and think about how horses would live in the wild, horses that are out in pastures like this, they tend to graze for anywhere up to 23 hours a day, which is known as trickle feeding. The bodies have adapted to eating particularly poor forage. So, you know, they're not used to eating dairy pasture that we've got in our fields just now. It's very, very rough grazing that horses tend to have in the nature. So what they do is they tend to eat constantly all day and just eat little and often of poor forage, which keeps them going. And what's happened is that their stomachs have adapted to this constant eating. And because of that, what they've done is they constantly produce gastric acid, which you probably will all have heard of Pavlov with his dogs and the experiments that went on previously about being able to stimulate dogs to produce saliva and also to produce gastric acid at a stimulus when you produce food. It's very, very different with horses. Horses do not just produce gastric acid when the food arrives, they constantly produce it, and that's one of our reasons why we have issues with horses that are fed differently the way we keep them just now, as opposed to how the body has evolved them to live from where they are in the wild. What we have done is we've taken these horses off the pasture and we've given them beautiful stables and we feed them high quality forage. We pop in nets like this. We also then give them buckets of feed, which are high in quality, highly calorific, and horses eat them very, very quickly. And then what we do is we keep them in stables for long periods of time. So what tends to happen with our domesticated horses, if they're stabled certainly, is that they will eat high quality forage and bucket feed. And then what they will do is they will stand in the stable for long periods of time where the stomach does not have any feed in it because they've run out of food, they've eaten their hay net, they've finished off their bucket feed, and then they're stood in their stable with no further access to forage. The stomach empties, but the stomach is then constantly still producing the gastric acid, so they have an empty stomach that's full of acid, but without the forage there to help buffer the effects of the acid. And this is one of the main reasons why we have problems with our domesticated horses with this condition. We also have to think about the specific anatomy of a horse's stomach, which is very, very different to the likes of us or to the likes of dogs and cats. The horse's stomach is comprised of two different parts, and you can look at it simply as the top part or the bottom part, or the way we term it would be the squamous top part of the stomach and the glandular part of the stomach. If we look at the lower part of the stomach, the glandular mucosa, this is a schematic diagram of the cells of the mucosa in the bottom part of the stomach. And what's really important to think about here is this parietal cell here. This is the cell that produces the hydrogen ions, which ultimately then diffuse into the stomach or pumped into the stomach to then form the gastric acid. What these cells do is these cells combine water and carbon dioxide. I apologize for the chemistry lessons, we'll not be too specific carrying on with this, but they combine water and carbon dioxide, and then we have this chemical equation here where you can see we produce the hydrogen ion here, which is the acidic ion, and the bicarbonate ion here. So very, very simple chemical equation there, and this is what the parietal cells do. Once this chemical equation has taken place, this bicarbonate ion here, it diffuses out into the bloodstream of the mucosa. As you can see, it then diffuses into the non-parietal cells next door. These cells they're not glandular in nature in that they don't have that same chemical equation that happens in them, but they're almost like transfer cells. So they take this bicarbonate ion into the cell here, and then they allow that bicarbonate ion to then move into the lumen or the center of the stomach here. Now that bicarbonate ion forms with this mucus barrier that we have, sits in here. So all of a sudden we've got this alkaline mucus that lines the stomach where you have your gastric acid in the center here. So imagine this is your liquid gastric acid in the middle of the stomach here. You can see that we've got this bicarbonate mucosa here, which helps to buffer the effect of the acid on these very, very fragile cells here. We all get this physical barrier, which is fantastic, but what also happens is if some of these hydrogen ions enter into this mucosa here, all that happens is you get a reversal of that chemical equation that I showed you previously, where the bicarbonate and the hydrogen ion then cancel each other out, and you get production of carbon dioxide and water again. Then go back to your parietal cell here, and we think about all these hydrogen ions that are built up in this cell here. Now, what we have to look at here is the fact that we've got significant acid in the stomach here, so very, very high concentration of acid ions here. These ions will not naturally diffuse out like you could see the diffusion of the bicarbonate ions. These hydrogen ions are basically stuck in this cell until they are actively moved from the cell into the center of the stomach here. And what we have is this little pump here called the proton pump, which is very, very important. This is an active pump that pumps the ions from here and moves them out into the stomach lumen to then maintain the concentration and quantity of acid in the stomach there. This all occurs in the lowest part of the stomach in the horse. But what we've got to consider is that why is that different from other animals? Well, we've got some nice schematic diagrams here. This is the sort of schematic diagram if you think about the likes of us or your pet dogs and your pet cats. The glandular mucosa covers the entire area of the stomach. And as you can see with this blue lining here, we get this lovely protective mucus barrier over the whole lining of the stomach. When you then move forwards and look at the horse's stomach, you'll see very specifically they are different. So we've got these two parts of the stomach. You've got to think about the top third of the stomach and then the bottom 2/3 here. And you can see very, very clearly the difference where you've got the non-glandular squamous mucosa in the top third of the stomach and this glandular mucosa in the bottom part of the stomach. So the glandular mucosa produces this mucus, and you can see that this whole lower 2/3 of the stomach are very, very nicely protected by the mucus, but we do not have that same mucus protection in the top part of the stomach because the squamous cells do not produce this mucus here. The membranes in the top third of the stomach have absolutely no protection against the gastric acid that's constantly produced in the stomach here. This is a really nice post-mortem picture. I hope none of you are too squeamish about it, but it's nice to actually see a genuine picture of the stomach rather than just the schematic diagrams. So you'll see here, this is where the feed enters from the esophagus. This area here is known as the cardia. So feed enters in here. And this is the squamous part of the stomach here. So you can see that nice pale pink mucosa here. And what you can see is that very, very specific demarcation between the top and the bottom of the stomach here. This is called the margo plicatus, and this is a very, very obvious landmark when we put the endoscope and the fiber optic camera into the stomach, it's very, very clear to see the differentiation between the top and bottom parts of the stomach. We've got the lesser curvature of the stomach here, and then we've got the greater curvature, which is the largest part of the stomach down here, moving through to an area that's very, very important, and you'll see that later on in the talk, to the pylorus at this part of the stomach here. This is where feed exits the stomach and enters into the small intestine here. So how does it happen? What happens to cause these lesions in the stomach that causes your horses so much problems that we've already looked at? This is a lovely diagram of a resting horse's stomach. So if you can imagine your horse, it's finished its feed, its stomach is empty, but the horse is just standing, resting in the stable. Well, that itself isn't causing too much trouble at this point in time, because although we've got the acid, we know we've got the bicarbonate buffer and the mucus here to help protect the stomach. Where we get the pathology occurring is when we start moving this horse when it has no food in its stomach. Very, very quickly, you can see that the acid starts moving around as the horse starts doing exercise. And then as the stomach gets compressed, as the horse is breathing, and also as the intestinal tract moving against the diaphragm as the horse is breathing, you'll see that this gastric acid gets splashed around in the stomach. And very, very quickly, this acid is splashed into the top part of the stomach. And we know categorically that this is a direct cause of these squamous lesions forming. So in the top part of the stomach there, this is directly caused by acid splashing. So a horse has got an empty stomach, and that liquid acid is splashing upwards when the horse is moving. So this is really, really important to think about if your horse is diagnosed with these type of lesions, in that this is something that we can treat, but also readily manage to stop this from happening. So going back to how we keep our horses, this is caused by horses exercising on an empty stomach. Very, very much a management condition that causes horses to have these lesions. Here's a really nice video. As you can see, here's the horse is breathing in. And as the horse starts moving, you can see that the intestinal tract here moves forward. So as horses are cantering, they breathe in rhythm with their gait. So as the horse breathes in, the lungs fill and the intestinal tract moves backwards. But as they exhale, the lungs empty, the stomach moves forward, and the intestines then squash up against the stomach and onto the diaphragm. So you can see how that stomach is compressed between the diaphragm and the intestines as the horse moves there. I'll just let that play just for a second there, because it's a nice video to help indicate to you why this is a problem, particularly when horses are exercising. We've got some nice photographs here of, this is the lesser curvature of the stomach. It's almost the same image that you've got on each side here, but we've got the difference between a healthy stomach and an ulcerated stomach here. You can just about see, this is the endoscope entering the stomach here at the cardia. So the endoscope enters the stomach and then curls around and then turns back on itself to see this part of the stomach. The pylorus, the lowest part of the stomach, is sitting just down here. Again, you can see the endoscope just entering here, but this is a common area in the stomach where you can see squamous lesions if you've got them there. So you can very clearly see the nice pale pink mucosa here, and then look over here, you can see extensive lesions, both in the squamous and actually in the glandular part of the stomach here. Then we want to think about the glandular gastric disease. So these are lesions that develop in the lower two-thirds of the stomach. And how does this actually happen? Because we've already spoken about the buffering with the bicarbonate and the mucosa there, but we know that we still get lesions in this part of the stomach. The unfortunate thing is, and we say we, this is a sort of generic we of the veterinary world, we do not have an absolute definitive answer to tell you exactly why lesions develop in this part of the stomach. Very, very commonly, we see lesions developing around and about the pylorus here, and we very, very strongly believe that it is stress related more so than any other reason. So although management changes can help this or possibly contribute to it in the first place, it is more than likely that it is a stress condition that causes lesions develop in this part of the stomach, which of course is entirely different to the squamous lesions that we see in the top third of the stomach there. further photographs for you here. I think you can very clearly see the difference that we've got here. This is a very, very healthy looking pylorus. You can see the very, very pale pink mucosa here. There's just a little bit of an indication here where you can see the mucus here. We've got a little bubble of mucus here and a little string, a sort of jelly-like string here. This is indicating that mucus protection that we've got in this part of the stomach. And then we move over to the other side of the stomach, and you can very, very clearly see the difference there. We've got a hemorrhagic erosion here. We've got swelling in the area, and you can see the mottled appearance of the mucosa here. And just this whole area is looking very, very inflamed and unhappy here. Very, very big difference between healthy and unhealthy here. This is the type of thing that we see particularly commonly actually in our population of horses that we see at Lochleven equine practice. And this is really not nice to see. How is it that we are able to give you a definitive diagnosis? Because quite frankly, we always try and work with evidence-based medicine, which means proving to you that the animal has got this condition. And when we know for certain and have got that definitive diagnosis, it then enables us to recommend the best forms of treatment for your horse. The only definitive way of being able to give you that diagnosis is via gastroscope. So putting a fiber optic camera down into the horse's stomach and actually being able to physically visualize the lesions that the horse has. As I said before, we can get indications that your horse may have gastric lesions based on the clinical signs that the horse is showing you, but this is the only definitive way where we can definitely tell you that your horse has got this problem. So how do we go about gastroscoping your horse? Well, we have got a very specific method that we use to have a look in the horse's stomach. What we have to ask you to do is to starve your horses overnight. This is because if the horse's stomach is filled with feed, we are then not able to visualize the membranes and the lining of the stomach as we need to be able to give you that definitive diagnosis. So the horses have to very specifically be starved overnight. A lot of the time, horses are brought in to us at the clinic here because sometimes owners can find this very, very difficult. Of course, you can take feed away, but quite often hungry horses will eat their bedding. They unfortunately can even eat their own feces if they're really hungry, and unfortunately that's something that we see as well. So a lot of the times horses have actually got to be kept in stables with no bedding, with muzzles on, and make sure they're on the rubber matting just to make sure they don't have any access to feed in their stable. We then try and look at them the next morning. All horses are heavily sedated, even if they are particularly well-natured. We need to make sure that the horses remain incredibly still. And the reason for this is that the gastroscope that we have to use, it is particularly long. It has to be a full 3 meters long to be able to get into that lower part of the stomach, as you've seen with the diagrams there. So we have to make sure the horses are very nicely sedated. For that reason, they are very, very nicely relaxed as well. It's much easier to pass the endoscope when they're not worried about what we're doing. And we gently pass the endoscope down into the stomach, and then we can visualize the lining of the stomach and have a look to see if we've got any lesions that we need to be concerned about. This is a photograph of us. Yeah.
Sorry, can I just interrupt? There's a couple of guys that are having trouble seeing the screen sharing. Are you able to just stop screen sharing and then start it again? I think it doesn't appear to be everybody, but if you can just try to reshare your screen, that would be super.
Let's try again.
Okay,
back to
you
the
can
right
let me know
place.
in the chat box, guys, whether that's helped at all.
That's back to where we were just a minute ago.
Heather, I know you had said you were having an issue. Can you just let us know if that's working now? So right, okay.
Still not working well?
No, it's only a couple of people have not been able to see the screen share, but everyone else seems to.
Oh, I'm sorry for the people that are having difficulties there.
We are streaming it live on Facebook as well, guys.
Yeah, that would probably be more helpful. Maybe if you try and log in a different manner rather than through this link, it might be possible for you to visualize it through the Facebook.
We'll just get that link for you now quickly.
Super. I think I'll just carry on here. This was just a photograph or photographs of a session that we were undertaking recently, and you can see how recent this was, judging by our COVID protection here. But it was just a nice illustration of the different types of horses that we see coming in for gastroscopes. You may look at some horse and look at this horse, this is a big competition horse, and say, oh yes, well it's highly likely that this horse has got some issues here in its stomach, just based on the type of horse that it is and the nature of the work that it does. But other horses that are clearly not working horses or riding horses can still be presented with problems. That means that we want to check to see if they have got issues in their stomach there. So it is important to remember that although certain breeds and types of horses are predisposed to these gastric lesions, it's important to consider other horses as well, because it may well be that these little companion ponies or possible kids' little ponies, they could be suffering from this condition as well. So it is really, really important to consider them as well, rather than just thinking of your sort of classic horse that could be affected with this condition. When we look inside the horse's stomach and we see lesions, we give them a grade. Now, this is a sort of historical way of putting a number to the lesions that you see here. And we've got this grading system from 0 to 4. So 0 would be a completely healthy stomach. And as the lesion severity and number increase, the grading also increases. So you can see here the grade 4. It's very, very obvious that this horse has got large, extensive, deep erosions in the stomach here, versus grade 1, which is barely visible. Possibly might struggle to see that on your computer screens there. A few things to think about which are important with this is that these grades are very subjective, in that I might look at some of these lesions and say, well, I think this series of lesions would be a grade 3. And my colleague Karen might come in and say, actually, no, I think they're a grade 4 or possibly even a grade 2, depending on her benchmarking of the different appearance of the different lesions. What we try and do these days, and we have the ability to do this with the video endoscopes that we have, is that we prefer, rather than just giving a number, which we do still use, we prefer to take images of all the lesions that we see, because if you have the photograph, it's then much, much easier to then look back a month later when you recheck these horses to see if there's been an improvement or not. So although your horse may be given a number to say your horse has got grade 3 lesions, generally we'll also be looking at the photographs as well to help explain the severity of the condition based on the physical appearance of the lesions there. The other thing that's really, really important to realize there, and certainly this information has come from human studies simply because it's very, very difficult for us to understand how much pain a horse is in. We obviously don't have the ability to just ask them how uncomfortable they are. So we've extrapolated this information from human studies. And it's important to remember that the discomfort that a horse is suffering from the lesions does not correlate with the grade of the lesion. And all that means is that these grade 4 lesions to one horse may be less uncomfortable than, for instance, this grade 1 lesion, which may be causing a lot of discomfort to one horse, and this may not be causing significant discomfort to another horse. And I know that doesn't seem very logical when you look at the appearance of these different lesions. But as I said, this information has come from human studies, and it's important to remember that that is the situation. So when you're thinking about, does this small minor lesion need treating, it's important to remember that the pain is not directly linked to the grade that we give them. How do we go ahead and treat these lesions? Well, really, we have to think about this statement here. If there's no acid in the stomach, then there's also going to be no ulcers, because it's that very, very low pH that causes the damage to the membranes. What we've come to realize is that this drug, omeprazole, is what is termed our gold standard treatment of choice when dealing with a diagnosis of equine gastric ulcer syndrome. Omeprazole is a drug that is known as a proton pump inhibitor. So go back to these schematic diagrams that I showed you earlier, that small little pump that takes the hydrogen ions from the lumen of the parietal cell into the lumen of the stomach. Omeprazole works to block this proton pump. If we can stop the acid ions moving from the parietal cell into the stomach, of course, then we simply have less acid in the stomach to cause the damage that it does. This is very, very important to think about, the reduction of acid in the stomach, because that's simply what we have to achieve to get these lesions to resolve. What's also important to remember is that this does not interfere with the diffusion of the bicarbonate ions. Remember, they came up into the bloodstream and diffused into the non-parietal cells next door. that chemical process still happens. So you still have the movement of bicarbonate into the stomach and reduction in the concentration of acid within the stomach there. So this is our pH scale here, and what we've got to think about it. So hydrochloric acid, which is our gastric acid here, so sitting around a pH of basically 0. What we need to try and do is we need to try and increase that pH to at least a minimum of 4 to allow the body to repair itself. So that's what we are aiming to achieve by treating these horses with omeprazole, is to increase the pH, not quite towards neutral. We're never going to achieve a neutral 7, but if we can try and move it towards 4, that's when we know we're going to get healing of these lesions. So then we've got to think about how often do we give the treatment. Well, it is very, very slightly dependent on how do we give this medication, which I'm going to move to just shortly. We have 2 options of giving omeprazole. We can either give it orally or we can give it in an injectable form. And the choice of administration is very much case dependent on where the lesions are in the horse's stomach. So if we're giving oral medication, which frequently we do, particularly for squamous gastric disease. So those lesions in the top part of the stomach, we tend to give oral syringes, and we dose these once a day. This period of 24 hours is the time it takes for the body to start reproducing these proton pumps in the stomach. So what we need to do is we need to try and give this medication to make sure that all those proton pumps are inhibited to keep that level of acid more towards the neutral than towards the 0 that it would normally be at. It does take a little while. It takes 5 days really for the oral medication to reach the level that you want it to, a sort of maximal effect. So there is just that little lag effect, but that once daily dosing is very, very important for that. We do tend to treat cases for around about 1 month before we then reassess them to allow that period of time for these lesions in the stomach to resolve. We also use another medication known as sucralfate. This is a powder that we give in feed, and in the stomach, it reacts with the acid and it forms like a viscous paste, like a gel within the stomach. And what that does is it helps buffer the acid and prevent it from being quite so liquid, as you can see is the issue that we have when these horses are standing still. What we also have with the sucralfate is it attaches to these proteins, albumin and fibrinogen, which are proteins that are lining the surface of the erosion, so the inflamed membranes on the inside of the stomach where we have our problems. This sucralfate can actually attach and bind to these proteins, almost forming like a plaster, almost like a band-aid on these lesions. So it's forming a protective barrier that physically protects the lesions from the acid within the stomach. The other last job it does, which is very, very important, is it helps stimulate further mucus secretion on the lining of the stomach there. So this is another type of drug that we use, and we use that together with the omeprazole as well. And we particularly use the sucralfate when we have got glandular gastric disease, so the lesions in the bottom part of the stomach. We don't always use this, but it is very, very much case dependent. We have the 2 different types of treatments here. As I said, it does vary from case to case, but what we tend to work with is the squamous lesions in the top part of the stomach tend to get the oral medication. You've hopefully heard of the Pepsol, or Gastrogard is another product that can be used there. So we normally treat with these oral syringes, and we also then need to alter the management changes and the feeding that have predisposed us to getting into this situation in the first place. And we can also think about some feed supplementation to help them as well. We have this relatively new product, this injectable omeprazole, which we are now tending to give for lesions in the lower part of the stomach, so your glandular gastric disease, as a lot of the recent studies and the evidence supports the fact that the injectable omeprazole for those lesions in the lower part of the stomach works significantly better than the oral dosing that we have used previously. We do also tend to add sucralfate into the mix with lesions in the lower part of the stomach there. And again, we look at the management changes, which we'll talk about just shortly there. A lot of people will ask us about supplements that they can give to help their horse. It's just important to look at a number of the different things on the list here, which specifically have got no supportive evidence to suggest that they're going to do any good at all. So, you know, people do try and give alternative medicines, which is absolutely fine, but it's important to realize that there is absolutely no evidence to support the use of these. And also we need to consider the fact that possibly administering these types of supplements may interfere with the treatment itself. So it's advisable not just to go ahead and use your own products that you decide to use, that you maybe found some information on the internet and such. These are not products that we go ahead and recommend when dealing with lesions. What we do recommend with alternative therapies is to use probiotics. Probiotics have certainly been shown with studies that they can be very, very helpful in helping acid ulcers heal and helping maintain the integrity of the mucosa within the stomach there as well. So it's very, very important to use these probiotics. We also have a supplement at local Even Equine practice called Gastric, which has got these pre-probiotics in it, but it also has what's called an alginate, which is a seaweed extract. And what happens is that alginate in the product absorbs water and liquid from the stomach, and it helps form a gelatinous mat within the stomach. So whereas before, prior to feeding, you've got this liquid acid in the stomach, this product helps form a gelatinous mat in the stomach, so it prevents it, or at least helps minimize the risk of acid splashing to the top part of the stomach there. Scientific studies have very much shown that administering corn oil to your horse once daily could certainly help in the treatment of glandular lesions. This is something that I certainly like to recommend. It's very, very easy to dose. It's not having to use any medication. It's very, very simple to give just once a day. And knowing that that's going to be helping your horse as well is a very, very good product to be feeding them as well. So if you do want to give alternative therapies, think about your pre-probiotic supplements. If you can find one with an alginate, fantastic. And think about trying to find your corn oil to help them as well. How do we prevent these lesions from coming back once we've treated from them? What we can do when we've got the oral dosing is we can then reduce the dose down to 1 milligram per kilogram. This is what we call the quarter dose. And once we've treated your lesions, particularly in the squamous mucosa, we can then drop the medication down to give just that quarter dose there. This is not something we tend to recommend with the injectable medications, because that tends to be for the different lesions in the glandular mucosa, the bottom part of the stomach there. But certainly this is something that you can be aware of giving. A lot of people will use this if they know their horses are prone to it. They'll give lower doses of omeprazole, for instance, when horses are going to be put under periods of stress, possibly changing yards, going out, competing, staying away from home, traveling for long periods of time. It's something that you can consider doing. So before you know your horse is going to have an issue, is to get them on just to a low dose of the omeprazole there. Keeping your horse on the supplements that I previously discussed. If you know that your horse is prone to these gastric lesions, it's advisable to keep them on these supplements. So think about your pre-probiotics, your corn oil, and keeping them fed, as we're going to discuss just shortly. It's really, really important to do that. And the management changes that are discussed with you, as I said, just shortly in the talk, but very specifically on a case-by-case basis when you have your horse diagnosed, it's really, really important that you keep them up as well. When thinking about the oral medication, when do we give the drugs? Well, the studies have shown very definitively that the omeprazole is best given on an empty stomach, which is a little bit counterintuitive, because we've already said too that we'd actually rather your horse had plenty of food in its stomach. But if you can give your omeprazole first thing in the morning, what tends to happen is that horses tend to eat the forage that they're given overnight and empty their hay nets, and then stand for a natural period of time without any food in their stomach. So if you can give them their omeprazole first thing, and then wait so 30 to 60 minutes, half an hour or so, before you give them a bucket of hard feed, and then wait even longer to give them, or turn them out to grass, or give them their hay nets. That's the ideal way to administer the omeprazole, because what you want to do is make sure that this medication is fully absorbed to have the maximal effect, and make sure that feed does not alter how that medication is absorbed. Doses, we've spoke about that just a little bit there. I've got these slides a little bit out of sync there, but the full dose, so the full dose for the treatment, 4 milligrams per kilogram, which generally in an average size horse, so 500-600 kilograms, works out around and about 1 syringe a day, versus the omeprazole injection, which we tend to give this injection just once a week. That's administered by ourselves, by your veterinary surgeons there. And on top of that, you tend to give your powdered sucralfate in a small feed or in a paste that you can administer directly into the horse's mouth there. What's important to see here is that we tend to recommend treatment for, say, 3 to 4 weeks, but we work on generally a period of 4 weeks at local Even Equine practice here, before we then bring your horse back in for further assessment and repeat gastroscopy. We went through this earlier, thinking about the exercise as a known trigger factor here, and remembering that the video that we saw earlier there. It's very, very important and very, very easy to resolve this by simply giving your horse some form of fiber feed before it goes out and exercises. And I can remember back to pony club days when I was a child, and we were specifically told not to give our horses feed before we worked them. Now, I'm not saying to you, give them a large bucket of hard feed. What I am saying to you is it's very, very important that they have some form of fiber in their stomach before you work them. So if you're a keen bean and you like taking your horse out first thing in the morning directly from its stable, do make sure it's had some hay, or even literally just a handful of chaff that you can pop in a bucket there, because by giving it that small quantity of fiber, you will then produce that matting effect on the liquid in the stomach, which will then prevent that acid splashing into the squamous part of the stomach there. It's very, very easy to achieve, and it makes such a big difference there. Thinking about the stress linked to glandular disease specifically, anything that you can do to try and minimize your horse's stress is very, very important. So thinking about traveling your horse with a companion, if that is something that you can do. Whilst they're in the stable, you can give them certain different types of toys that will entertain them. So these little toys that, as they knock them around the stable, you get little treats that come out of it there. Providing them with a mirror if they don't have a companion, so that they look at themselves and either just admire themselves in the mirror, or are slightly tricked into the fact that they feel like they've got a companion next door. All these different things are very, very important, just to really try your absolute best to reduce the stress levels that that horse has been put under. Makes a big, big difference. Feeding. What you want to try and aim to do is you want to try and give your horse as much forage as you are able to do. Now, it's also important to remember that you may have some weight management issues. So if you are not able to give ad lib forage, then what you can try and do is little and often feeding as much as you can throughout the day, and dare I even say it, at the night. And I'm not advocating that you're getting up in the middle of the night to give your horse a small quantity of feed. What you can do is try and administer feeding in such a way that it slows down your horse's eating and takes them longer to intake that forage. So there's a lot of trickle feeding hay nets. You can double net hay nets. You can hang hay nets from the middle of the stable so they're not leaning against a wall. Lots and lots of little tricks to try and slow down your horse's feeding to make sure that feed lasts longer, so that they are not standing for periods of time standing with just that liquid acid in their stomach. If you can try and keep the starch quantities, so basically overall, the grain, the carbohydrate level in their concentrate feed, try and keep that as little as possible, because these concentrates, as they're digested into acids. So they stimulate the production of further acids within the digestive tract. So if you can try and minimize the amount of carbohydrates and grains that they have in their feed, that's certainly advisable. Try and keep it as natural as possible with as high a fiber as you possibly can. Try and keep these feeds as small as possible. Adding lots of chaff to them, that's fantastic, because of course you're increasing the fiber load there. We talked about omega-3 fatty acids, your corn oil, your linseed oil and such. These can be great ways of adding fat to the diet to help a horse maintain its weight if you're not able to give it the sort of concentrate feeding that you would normally be liking to feed your horse. That's really, really good way of getting them to maintain their weight. And of course, as you always would do, making sure that they've got an adequate supply of constant fresh water, which of course is just your standard horse maintenance there. Just remember that your carbohydrates, your starch, they stimulate the acid there, but your proteins, they can buffer it. So that's very, very important. Try and keep the level of starch in the horse's feed down to an absolute minimum there. Go to your feed companies, speak to them. All these different companies have got wonderful feeding that is specifically formulated for horses that have either got or are prone to gastric ulceration. They will give you great advice. Every single one of them will have feed reps that you can talk to. And if you approach them directly, they can help you formulate specific feeding for your horse to make sure that you're maintaining the weight of the animal that you want to, make sure that it's got absolutely all the energy that you want it to have, but make sure that you're not feeding the wrong products there. Illness is very, very stressful for horses, and we have to remember that. So it's important that when your horse is ill, is to consider the response internally and what can be actually going on there, and to feed them accordingly, but also speak to us about measures that you can put in place to reduce these stress, and obviously trying to treat the illness as soon as possible. So it's just important to remember that as well when thinking about what is caused by what stress causes, and certainly illness is a big cause of stress to all our horses. We're coming to the end of the talk here, but it's just worth highlighting the ability of doing gastroscopes at the Lochleven Equine Practice Clinic here. We try and promote our gastroscope clinics, which happen the first week of every month. They happen at the clinic here. And the reason that we try and encourage everyone to come to these clinics is that they do happen at a significantly subsidized cost. So you can see here the difference between your first gastroscope here for just £105 and then £204 for the repeat scope. We can, of course, perform gastroscopes at any other time, but of course you can see that the cost is significantly higher to yourself. So we do try and encourage people, if you can come to the gastroscope clinics, it just means that we can offer you that greatly reduced cost there, which means it's just less of an implication for yourself when you're looking for that diagnosis, or possibly even the negative diagnosis there, which of course we would much prefer to be giving you that negative diagnosis there. Coming to the end of the talk now, just remember everything that I've told you here. Remember that we have naturally predisposed our horses and made them susceptible to these gastric lesions because of the nature of how we keep them. So just try and remember to keep horses as naturally as possible, feed them as much as possible. Remember that there is no particular symptom or clinical sign that will give you that definitive diagnosis. We've just have this array of these vague clinical signs that you just need to try and remember in the back of your head. If you start noticing any of these signs, just consider coming and talking to your veterinary surgeons and seeing if it's worthwhile organising a gastroscope for your horse. Remember, that's the only way that we can definitively tell you that your horse has or has not got these gastric lesions. And also remember that the grade and size of the lesions does not directly correlate with the pain and the effect that these lesions are having on your horse. It's important to remember that. We know that the treatment is via metrazole, different ways of administering this drug depending on each individual case. And remember all the management changes that we've discussed about minimizing stress, optimizing the horse's feeding to help reduce the susceptibility of the condition is very, very important moving forwards once you've got your diagnosis there. And that brings us to the end of the talk there. I don't think we've not done too badly at all time-wise, actually. So now, having done our talk, we can move on to opening up for questions that we've got in.
Great. Thank you very much, Jenny. We've had quite a few questions, so I will do my best to get through them all. Let me just have a quick pick. Now, actually, one of the questions that came in earlier and just linking to the price of the scoping was about sort of the benefits of just treating rather than scoping. And it was actually linked to your statistic where you said that only sort of 1% of the horse population were actually being treated for ulcers. And was that linked to the fact that, you know, how easy it is to get medication if they haven't been scoped? So can you just maybe, I know traditionally everyone used to just give them a...
Yeah, no, that's a relatively straight one to answer. So in modern day veterinary practice, we like to use what is called evidence-based medicine. And what that means is that we like to try and gather evidence to prove everything that we're doing and be able to fully justify why we're doing it. So as your veterinary surgeons, if we consider that your horse may have gastric lesions, we would strongly recommend that you have your horse gastroscoped, because we want to be able to look inside your horse's stomach and definitively say to you, yes, your horse has got a problem, or no, your horse does not have a problem. Once we have got that answer and we have the definitive diagnosis, we are then able to give you the best advice with regards to the medication that you want to treat your horse. And as you can see from the talk that we've just been through, is that depending on where your horse has got lesions will then depend on what treatment you give it. Yes, we can justify giving treatment if we strongly believe that your horse has got lesions based on the clinical and presenting signs, even if we do not do a gastroscope. It's not ideal, but we can give presumptive, treatment on a presumptive diagnosis if that is your request as the owner. But you've got to realize that treatment is phenomenally expensive. Unfortunately, it's a very, very expensive condition to treat. Insurance companies, I don't believe in general, will cover the cost of treatment with the medication if we do not have a definitive diagnosis. They do not work on possible diagnoses. And from your point of view as well, and if you look at the costs relating to the gastroscope clinics, for just over £100, we could give you a very specific answer of yes or no, your horse has got problems, no, it doesn't have problems, and whether it needs treatment or not. And when you relate that cost to the cost of treatment, the cost of treatment is very expensive. And in a month, for a month's worth of treatment, it costs around about £1,000. So to me, I would much prefer to encourage everyone to have a definitive diagnosis so that we can say to you with certainty that we are giving your horse the right medication rather than making an assumption. But yeah, if you definitively said to us, no, I do not want my horse gastroscoped, we could justify giving it treatment if that was the situation, but it's not going to be recommended by us.
I think historically as well, practices didn't have access to the gastroscopes in the same way that we do, and most equine practices now will have their own gastroscopes. So whereas before you would have probably had to go to a referral hospital.
It's so easy for us to give you the diagnosis, one night of starvation, and then a straightforward procedure which tends to take in the region of 10 to 15 minutes is much better for your horse, to make sure that we are genuinely giving it the best treatment rather than making an assumption.
Great, thank you, Jenny. So another question that's come in is, do you think it would help horses to make scoping the same as dentistry and have a regular ulcer check yearly and further treatment when required?
No, I'm going to say, and that's probably my personal opinion rather than everyone's opinion, but I would rather say to you, rather than saying a once a year gastroscope, I would rather you gastroscoped your horse when the horse was showing clinical signs that it may have an issue, and then have a look at it, rather than just saying once a year it's time for your dental and we'll do your annual gastroscope, because lower grade lesions and how you are managing your horse may come and go as well. So just looking at one point in time, particularly if there's absolutely no clinical signs, is probably really going to spend your money and not gain you terribly much information. If your horse is showing any indication of problems, that's the point when I would prefer to do the gastroscope and actually undertake that procedure on the horse. You want to make sure that you're doing diagnostic procedures for a justifiable reason, not just because it's a particular time of year. And what you've got to think about with dentistry is not, it's not just a diagnostic procedure. It is there to routinely manage your horse's teeth, whereas a gastroscopy is a diagnostic procedure to then think about treating a condition. So yeah, I wouldn't recommend annually endoscoping a horse, even if it has previously had issues. I would recommend doing the gastroscope if your horse is showing signs of problems.
Great, thank you, Jenny. Now, Devon has asked and said that difficulty syringing my horse with the omeprazole. So was putting it in a small amount of feed. Will this affect her treatment or how it works with it being mixed in with the food?
It's certainly not ideal mixed in with the feed, because the absorption of the omeprazole is going to be inhibited by the feed in the stomach, even in a small quantity. So it is absolutely preferable to administer it directly into the mouth, so it's swallowed without any fiber there. I completely understand your issues, and some horses just simply will not tolerate the oral medication. So if that's what you absolutely have to do, then that's fair enough. But I would encourage you to use the smallest quantity of feed you possibly can to get the horse to eat the medication, to get it into its stomach, because you will be losing the effect of some of that medication. You want the full dose, you want the horse to have that full dose to have the maximum effect. You also don't want to be spending money on a medication that the horse is then not being able to absorb just simply because of the method of how you're administering it. And what I would consider with that specific situation is considering moving on to the injectable omeprazole, which you can absolutely guarantee is being administered with the once a week injection. Because giving it in feed, giving the omeprazole in feed it's just not going to be as efficacious as if you could administer it as it should be.
Super, thank you, Jenny. And Craig has asked about, on the previous slide, it said to add alfalfa chop to the feed. And his question is this just a generic feed type? Or are you recommending that specific?
Yeah, no, as a sort of a generic alfalfa chaff, grass chaff, straw chaff, any sort of chop where you can increase the fiber levels in that bucket of feed, slow down the speed of the horse eating that bucket feed, and and allow them to have that mat in their stomach, but take their time to eat it there. So yeah, basically bulking out the feed with fiber, any form of fiber, as long as it's low with the, if there's any carbohydrates added to it, if it's a sort of general feed. So yeah, adding any chaff is a very, very good idea.
Super, thank you, Ginny. Sorry, they're still coming thick and fast, so we'll keep going. Demi Lee has said, would you recommend not exercising my horse until scoping can be carried out? My vet's recommended that the horse needs to be scoped, and I did ask a further question about behaviour, and she said that yes, the horse is very girthy, tends to be awkward to mount. She also feels very crabby when first mounted, and bucking and bronking has become more frequent. So would your advice be, Jenny, that she stops exercising for now until she can scope?
Yeah, I mean, your specific example with the case that you have got of your own horse, if I was your veterinary surgeon, I probably actually would say that I would stop exercising that horse. If gastric lesions are causing the discomfort to make the horse behave as you've described, then that horse is clearly in a lot of discomfort, and you're exercising the horse is then exacerbating it and bringing about these behavioral signs. That horse it sounds like it's trying to give you an indication of the fact that it's really uncomfortable there. The other reason that I would suggest not exercising your horse, and I'm sorry if this sounds a little bit off the chosen subject, is that I would want to look after your safety at the same time as well, and I wouldn't want you riding a horse that was behaving like that, particularly with not knowing what the reason was and if it is an uncomfortable condition, because you've got to think about your safety before any. So if your horse is genuinely showing you the symptoms that you've described there, I wouldn't be exercising that horse, and I would be trying to get that gastroscoped as soon as possible to get yourself an answer. Is it a problem? Is it not a problem? And then at least you've got the understanding there. And if your horse does have lesions, then you can start administering treatment as soon as possible to help relieve that discomfort that the horse is in.
Great, thank you, Jenny. Now, Karen has asked, what's an anticipated time to heal an ulcer scenario? So assuming
that's a very good question.
The owner can manage them in a way to stop them, so all the management changes are correct and the treatment plan.
So assuming that you go with the treatment that is recommended by your veterinary surgeon, if you have a horse that has squamous lesions, generally irrelevant of the grade of lesion, so even 1 to 4, we would anticipate that those lesions would be fully healed or very, very close to being fully healed after 4 weeks or 1 month's worth of treatment. Squamous lesions respond very quickly to the appropriate medication and the management changes that we've discussed. Pyloric or glandular lesions tend to take that little bit longer. If they are having the injectable form of the omeprazole over the oral dosing, you should find a significant improvement with these lesions in the first month. But generally, with lesions in the lower part of the stomach, you tend to have to administer treatment for longer than you would in the top part of the stomach, and you'd be thinking about generally 2 to 3 months worth of treatment as an average. Sometimes it can be even longer, but it's very much on a sort of case-by-case basis of how we advise your horse is treated.
Super, thank you very much. Josie has asked, if a horse with a suspected ulcers improves significantly on a supplement, would you still recommend scoping and treating with omeprazole?
If by administering the changes, possibly the changes that we've discussed in this talk, and the clinical signs that you were concerned about have completely gone and your horse has returned to normal, I wouldn't be immediately rushing to gastroscope that horse, because just like we discussed before about, possibly routinely scoping once a year, if you've administered changes to that horse, which potentially has resolved the situation, you could end up gastroscoping that horse and not finding any lesions at all, which then is really giving you very little information to work on. So yeah, if you have managed to resolve all the clinical signs based on management and dietary changes alone, I personally would not be immediately recommending you have a gastroscope. But if there's still clinical signs, then yes, I would.
Brilliant, super. Now, Veronica's asked, I think, a really interesting question, which is, how many hours is it totally safe for a horse to have no access to food?
That is a very good question, and I am not going to be able to give you an absolute definitive answer to that. The reason I cannot give you a specific answer is that horses' stomachs empty in different speeds. So one horse's stomach may empty very, very quickly versus another that empties very slowly. And we see this a lot when we bring horses into our clinic. Every horse is starved in exactly the same manner. So they're starved from 10 o'clock at night, and they have no forage at all throughout the night, and then we start scoping them in the morning. And we normally schedule our gastroscopes, so 9 o'clock, 10 o'clock, 11 o'clock, and so on. And every horse has been under the same protocol, but you can imagine that, you know, the horse that's gastroscoped at 10 o'clock has then had an hour longer starvation than the horse at 9 o'clock. But you can still see some of the horses that we end up gastroscoping at maybe 12 o'clock or 1 o'clock that still have got feed in their stomach, despite the fact we know that they have had zero access to feed in a stable with no bedding and have got muzzles on. So in answer to your question, unfortunately, I cannot give you a specific answer as to the timescale of how safe is it. You know, horses do empty their stomachs reasonably slowly. So certainly not having forage, as long as they've had a stomach fill, they could certainly stand for a good number of hours. I mean, 3, 4, or 5 hours, depending on the individual horse. But unfortunately, I'm not going to be able to give you an information as to a particular number specific to your horse. The best advice I could say is as little time as possible to realistically manage your horse. And it's better off trying to use the different techniques that were mentioned to try and prolong how long the horse's forage is going to last and slow its feeding down so it spends very, very little time with no food at all. So yeah, my answer would simply be as little time as possible, but I'm sorry not to be able to give you any more of a specific answer.
Great, thanks, Jenny. Sandra has said that she is using the pill form of sucralfate twice a day now, as the ulcers came back after omeprazole. If they don't disappear with this or reduce, what would the next step be?
If you have got all the management changes in place and you're still having issues, unfortunately, I would suggest you go back to your omeprazole there and look again and try and look again at the case and consider why is the horse getting these lesions and what can be done to minimize it. But if you've treated it, you've put all the management in place and you've still got issues with the clinical signs showing that you were obviously concerned about in the first place, unfortunately, it sounds like you're going to have to go back to omeprazole treatment to resolve those lesions.
Super, thank you. Caroline has said, what is the thought on hay versus haylage?
In an absolute ideal world, I would suggest that all horses with gastric lesions are fed hay because haylage is more acidic. That being said, it's not practical for a lot of people. A lot of people don't have access to good hay. Particularly not in Scotland, we don't always make the best hay depending on the individual season that we have. A lot of people prefer to feed haylage, far less problems with dust and respiratory issues there. But yeah, in an ideal world, I would suggest that hay is better than haylage, but I tend to only recommend changing to feeding hay if we've attempted all other recommended management changes and feeding changes, and we're providing the treatment that is necessary and we're still not achieving the desired effect. At that point, I would recommend changing off haylage onto hay, but I wouldn't do it as a first line change. You know, the first time I saw a horse, I would only tend to recommend changing onto hay versus haylage if the case is refractory to everything else that we're doing for the horse.
Super, thank you, Jenny. Right, I've just got, I think, 3 more on here and then just a couple more from Facebook as well. So we'll just try and whiz through those quickly for you guys. So Debbie's asked, if my horse after 7 days is seemingly happy to be lunged but not to move with tack on, is that still ulcers or could it be something else causing the issues? I'm assuming that that's after 7 days of treatment.
Yeah, I mean, certainly after 7 days of treatment, we know that there's going to be significant acid suppression and that healing will certainly have started. And depending on the degree of lesions that the horse had in the first place, you could have actually achieved a reasonable amount of healing in that initial 7-day period. So it sounds like your horse is showing signs of improvement, but is still giving you indications that there are still ongoing problems as well. What is something that you should also bear in mind is that horses are in a way very clever, and they actually have memory with regards to what does and does not cause them discomfort. So if a horse has been living with gastric lesions that are uncomfortable and they associate riding or saddling up, girthing and mounting with discomfort, even if you then take that discomfort away, it can actually take them quite a long time to disassociate the different events with discomfort. And a lot of time, even if you resolve problems or resolve the pathology, take away the discomfort, you can sometimes still find that you still see these behavioral issues because the horse is remembering that it did cause it discomfort, and it is preempting the discomfort with the behavioral signs that you are seeing. So it's difficult to answer your question. There could, of course, be something else going on, and it'd be important to assess to make sure that the horse has got no orthopedic issues, no lameness issues, or any other causes of discomfort. But it is also important to remember that after 7 days, it's still probably got lesions in its stomach that are healing but are not resolved and still could be uncomfortable. So I would be considering that the horse still wants to have the full month's worth of treatment before you... I'm not saying not exercise the horse, because we certainly can exercise horses when they're receiving treatment, but I wouldn't be suggesting to you that after 1 week you stop considering the discomfort from the ulcers and then think about other conditions. I would give it a full month and then reassessment before you then, are able to assess whether or not the treatment has improved the situation in the stomach.
Brilliant, thank you, Jenny. And then just a couple of quick questions, then we'll get on to the ones because the guys on Facebook as well have been pinging them through. So Lee has said, I've heard that you shouldn't add water, make feed too wet for horses that have ulcers. Is this correct?
Sorry, you shouldn't add liquid to their feed?
Add water or make their feeds too wet.
That's not something that I am familiar with. I personally always like adding water to any horse's hard feed, no matter what you're feeding them, because it helps reduce the risk of choke. I personally, water being neutral, it's not going to contribute to the acid. Arguably, it adds a little bit of liquid to the stomach, but if your horse is eating fibre, that shouldn't be any issue whatsoever. So that's not a situation that I am at all aware of, and I cannot believe that feed with water in it would have any effect on the gastric lesions at all.
Super. Demi Lee has just asked, and you may have mentioned this in the talk, Jenny, I can't quite remember, but how long do horses usually have to be starved for before the scoping? Because we have, if they come into the clinic, we have a very set protocol, don't we, as to when it gets put in and taken away. Can you just go over?
I would suggest, if your horse is having a gastroscope, I would suggest a minimum of 12 hours. You could be very, very disappointed if you starve a horse for less than that and then gastroscope it and it still has feed in its stomach. So at least 12 hours.
Brilliant. Super, thank you. Right, let's get on to a couple from Facebook and then we will probably have to leave it there. So Caroline has said she's sadly missed the talk. Hopefully she's going to catch up on it. But can a horse be on a low dose of omeprazole permanently if they are stressy and show signs of ulcer behaviour?
Yes is the answer to your question, with no side effects whatsoever other than the unfortunate impact on your bank balance.
Brilliant.
Yep. No, I'm not meaning that to sound silly, but it would be a very expensive way of doing it, but there would be absolutely zero side effects to you doing that to your horse. No problems whatsoever.
Great, thank you. Tracy's asked an interesting question. Is there a link between ulcers and colic?
Colic is one of the symptoms that, if we have a recurrent colic, we certainly consider gastroscoping to see if there are any lesions in the stomach there. Colic is not a common symptom of gastric lesions, but it can be one of the symptoms. So it's not a common one at all, but it is definitely on the list.
Okay, great, thank you. Somebody else, Devon, actually emailed this question into me the other week, asking about pregnancy, mares in foal. Can that make ulcers worse or cause them to reoccur if they've had them previously?
That's a very interesting question, and as a general rule, I would say more than likely not. Most mares, when they're in foal, become more stoic and more relaxed due to the circulating hormones that they have, which by definition you would think would make them less likely to have problems with gastric lesions. The likelihood is that they would also be doing less exercise and less work, so therefore being put under less stress. So I would say very likely no. You can't absolutely rule it out because every horse is individual, but as a general, I would say it's unlikely that pregnancy would exacerbate an ulcer problem, and actually probably make it better rather than worse as a general.
Great, thank you. Now, a couple of different people actually have mentioned this, so I think it would be quite good just to cover it quickly, Jenny, is about the link between cribbing and windsucking and ulcers, whether there is a link, whether horses that crib and windsuck are more susceptible to getting ulcers.
It's a bit of a difficult one to answer because as far as I understand it, we do not currently have a definitive scientifically proven link between the two of them. So I think I would just have to answer the question by saying that there is no definitive science that is telling us that there is a link between the two of them. There are studies ongoing. I'm aware of Liverpool University doing ongoing studies about it as well, so we may get more information to be able to answer that question in time. But as far as I am aware, and I wouldn't want to say that's an absolute definitive, but I am not aware that there is a definitive scientifically proven link between them.
Super. And there was a couple of questions Angela was asking about from a feeding point of view. Her horse is on a balancer, and she was asking about adding oil in and stopping the balancer. But our advice, I think, would very much be that balancers are very good for our horses. And
yep.
They
balancers are in general, I'd say, is a very, very good option for a horse that is prone to gastric lesions, and you can add your oil on top of your balancer rather than thinking of instead of, you could add it along with.
Brilliant, thank you. And I think one of the last questions was about a couple of different supplements. Someone has asked about seaweed as a preventative, and also slippery elm. Have you ever used or seen improvements with slippery elm?
Simply cannot comment on that when I have no experience, and it's not something I would recommend. So no, I have no experience to be able to answer that question about slippery elm. Seaweed, it would make sense that it could help. I'm not experienced with using seaweed, pure seaweed, as a supplement. We only have the alginate extract in our supplements that we have very, very good evidence to suggest it works incredibly well. So I would suspect that a pure seaweed supplement would probably help contribute and have a similar effect, but I can't give you that as a definitive answer because I simply don't know the answer to that question.
Brilliant. Well, I think, guys, we're probably going to have to leave it there. We've covered as many questions as we can. Jenny, thank you so much for your time.
You're very welcome.
Very, very much appreciate it. We did pop in the chat box that this webinar's been recorded, so we will get that uploaded to YouTube and share that on Facebook and on our website as well. So you will be able to access that. But yes, thank you very much for joining us, everybody. We will try and get another one of these scheduled, probably in the next sort of 4 to 6 weeks. So yeah, keep an eye on the Facebook page and have a good evening.
Thank you. Good night.